I think always, I mean, I've had 17 procedures, and always there's just that fear that I'm putting my whole life in your hands, and some of them are strangers. I mean, the surgeon I've met, but the other people, you know, you meet the anesthesiologist that morning, basically, and nurses you haven't seen before, and in the OR, probably won't see them after. So it's always that fear: what will happen? Will it work? Will it not work? Even though you can bring a friend with you, people can be with you the whole time, it's still, you're on a schedule, and everybody has a task. So the first thing, you go in and things start, and you may get your IV put in at a certain point, and they're going to take your clothes away, and now you're in hospital gown. So that's it. You're no longer the person out on the street. You're now a patient who's starting to have something happen. Okay, but when you go from your room into the pre-op area, it's controlled chaos. You're there with, I don't know, 4, 5, 8 people who are getting ready. There's curtains being pulled, so there's all these nurses, all these doctors, all these assistants, all these people going around, and everybody is in gowns and hats, and the doctor comes in, and everybody says, you know, which part of the body, and they'll write on it, and it's all the things that are for safety, but it still feels like I don't know what's going on anymore. I already told you that, you know, and then you meet the anesthesiologist, and then you meet the head nurse or whomever. People come in and they say, hi, this is who I am, and do you have any questions? And at that point, it's sort of, absolutely not. I'm just terrified and hanging on for the ride. What am I going to ask you at that point? That always feels the most disorienting to me, is in the pre-op section. And then they come and they take you into the OR, and it's always surprising how cold it is. And I don't know why that feels frightening, but it always does, that suddenly it's real. I'm in this room and it's cold. But I will say anesthesia has gotten to the point now where I don't recall going under the last 2 times. I think that whatever the process is, it wasn't any more of this, let's count down from 100 or any of that stuff. It's just 1 minute you're there, and the next minute you're waking up. I think it's important to identify, for me, what I call the arc of pain. I'm a big person, so I tend to have a tremendous amount of pain in the very beginning that takes the highest doses of pain medication that makes sense for me, but my body also doesn't react well to pain medications. So I use it, and there's a lot of pain in the first, I don't know, 72 hours, 3 or 4 days, and then it tends to drop off fairly quickly. And so in terms of recovery, I think sort of knowing that it's not just a linear form, that you'll have pain and then it will just gradually diminish, I think it probably is different for everybody, and mine actually increases after I've been out of the hospital, and then it decreases fairly rapidly. And then I found that what happens is I push, because I'm healing fast and I'm feeling better, and then I'll have some periods where it will just ramp up again because I do too much.